Are you tired of waking up in pain and dragging your back through every step of the day? You don't have to live like this. And no, surgery and endless painkillers are not your only options. You are not alone and you are not broken. So many people today normalize back pain as just aging. But back pain every day is not normal and it can be treated. I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and I believe that movement is life and you deserve both. Let's define what we're talking about here today. For today's video, we're talking about chronic low back pain or tension, which is pain that stays in the back. It's a persistent, nagging, chronic pain. It may get a little bit better throughout the day as you do more movement, but in general, it remains with you on and off at least throughout the day. What we're not talking about today is sciatica. Sciatica is pain that goes down the back of your leg and can even go all the way down into your foot. Now, we have a ton of videos on YouTube, so please go check out our YouTube channel to find videos specifically on sciatica. But today we're talking about that chronic, nagging, unremitting low back pain. So what causes that pain? Well, from this far away, it's difficult to tell you what's causing your pain because there are many structures in the low back that can actually be causing this pain. It could be a fascial type pain. And if you've never heard of fascia before, let me explain what that is. If you take a raw steak and you try to pull the fat off of the meat and there's that really thick white stuff in between, that's fascia. And when it gets tight, it can really glue everything together and cause a lot of problems. It could also be a muscle pain. So muscles are dumb, and when muscles feel that there's any kind of pain going on, they contract because that's their one and only defense mechanism. That's the only thing that they can do. So when they contract, that puts compression through the joints and the discs. Well, the joints and the discs do not like being compressed like that, so they get super aggravated and they can start causing pain too. But wait, there's more. In your low back, you have nerves that are coming out right next to the disc and right in between the joints. So if the joints are compressed or the disc is bulging out, that can put pressure on the nerve, and that could be what's causing your pain. And the truth of the matter is, you can have more than one of these causing pain. In fact, when we talk about chronic low back pain that has been going on for months or maybe even years, I can pretty much guarantee you that you have all of these things going on. And the challenge is with chronic low back pain is that it can be aggravated by everything, by sitting, by standing, by walking, by laying down, by bending over, by doing absolutely nothing. Everything can aggravate chronic low back pain. Everything can aggravate chronic low back pain. But I know you want to know, what is causing my chronic low back pain? Well, the most common culprit is poor posture. So that could be either how you're sitting or standing regularly throughout the day that's aggravating tension to your low back. Number two would be muscle imbalances. So if you have a weak core, if you have weak glutes, if you have a tight psoas or hip flexor, all of these things can increase pain and tension to your low back. And for most people, it's actually number three, in that it's an old injury that we had when we were much younger and more flexible and had more energy that never properly healed. So it's rearing its ugly head yet again. It could be number four, in that you carry your stress in your low back and it tightens everything up, and that area never has a chance to move properly. And then there are people who are on opposite ends of the spectrum. So there's some people who sit for prolonged periods of time for work, and there's some people who do repetitive motions regularly throughout the day for work. And either one can cause wear and tear on your low back if you're in one position for too long or if you're repeating the same motion too often. So who is most commonly affected with this chronic low back pain? Well, it typically is people in between their 30s and their 60s, either who have that sedentary lifestyle because they work at a desk or who perform regular repetitive motions. And many people who are in their 30 to 60 year range may be parents and or caregivers. So it could be both, where they're caring for people around them who may be shorter than them or may need help getting in and out of bed. And let's not forget our weekend warriors, those of us who go out and spend all weekend doing all the things and all week busy at work. And a lot of people who are suffering with this chronic low back pain that will not go away have had episodes or bouts of low back pain previously. It's just that previously they were able to do things to get it to go away, and this time it's sticking around. If you are perimenopausal or menopausal, this can increase your risk for chronic low back pain because of the hormone shifts that happen in that season in life. How do you know if this is what you're suffering with? Well, first thing you'll know first thing in the morning, because you'll wake up and have stiffness that makes it difficult to move. Slowly throughout your day, you'll loosen up a little bit and you'll start moving a little bit more freely until you try to stand at the sink and brush your teeth or put your shoes on and tie your shoes. Then it comes back. Then you go and do your work, which may be prolonged sitting or repetitive task, which increases your low back pain. You get home and you're exhausted at the end of the day because you've been trying to manage your symptoms. So you reach for whatever you believe will help, which may be some over-the-counter medication. It may be a hot pack. It may be a drink, which doesn't really help to resolve your symptoms. And you fall into bed in pain, only to wake up the next morning and have the cycle start again. And I know that that story may sound all too familiar for some of you, so I'm going to give you some ideas of what you can do. First off, before you get out of bed, you want to be doing some gentle mobilizing exercises. So this is nothing crazy. We're going to do some gentle pelvic tilts where you're tilting your pelvis up and down. You could get on your hands and knees and do some cat camels and get that upper back moving. Some people like that knee to chest stretch where you bring your knee to your chest, either one or both at the same time. The only thing I would say about that one is I do want a word of caution. You don't want to be overstretching your low back because it's not really loosened up and warmed up yet if you're still in bed. Now, it's really, really important to strengthen your glutes and your deep core muscles. So we're talking not only about abdominals, we're talking about the hips and the pelvic floor as well. You see, when your abdominals, your pelvic floor, your hips are weak, this puts increased stress to your low back because these guys are all supposed to work together. And if some people aren't pulling their weight, low back may be compensating for them. One thing that can be really, really helpful is improving your sleep posture and making sure that you have a good quality bed. Now, I get requests all the time on what is the best bed, and I will say it's different for everybody. And I'm sorry, I know you don't like that answer, but it is still the truth. I have some people who love a sleep number bed and some people who hate a sleep number bed. I have some people who love the purple bed and some people who hate the purple bed. Everybody's different. What I can tell you is I sleep on a firm mattress with a pillow top, and that's what works best for my body. I will say if you have a firm mattress and you're female and you have curves, that you probably do need some form of pillow top or a foam mattress on top to take some of the stress off of those bony hips. One thing that I always do recommend is to do some deep breathing exercises or some breath work to help down regulate your body. When you are in pain, you are in a constant state of fight or flight, and that vagus nerve needs to be activated. So when you breathe deeply, it activates the vagus nerve, and that helps to down regulate your symptoms, which can make things feel a lot better. And it's not necessarily just short-term relief. It can be really long-term changes because when your system is down-regulated, you can get more blood flow to that low back that can help improve that healing and repair. And make sure that you're in a good posture while you're working and you have regular breaks from either your static position or your repetitive tasks. And friends, I cannot overemphasize the importance of hydration. I have so many people who come into the clinic and I ask them, how much water do you drink every day? And I've literally had people be like, I don't drink water regularly every day. Friends, at a minimum, you need to be drinking 80 ounces of water every day. Now, that may sound like a really big number to you, and that may not be where you're able to start. If you're not drinking water regularly, I want you to start at the 20 to 30 ounces every day and add 10 ounces per week until you get up to that 80 ounces. But it is critically important that you are hydrated so that you're able to clean your body out and the waste products don't stay stuck in that low back. All right, now you may be suffering with chronic low back pain. You have already tried all of those. You are a breathwork master. You drink 100 ounces of water every day. You don't stay in a static posture during your work day. You've worked on your biomechanics. You're strong and everything else is in line. And you're like, Dr. Amy, what else you got for me? Well, then you, my friend, are a perfect candidate for what we call regenerative medicine. What this is going to do is it's actually going to go into the tissues in your back. It's going to help do repair of the discs. It's going to help the joints move better. It is going to restore collagen production. It is going to decrease inflammation. It's going to eliminate muscle tension. It's going to help improve mobility, which will increase strength and get you back to doing all the things you love. It is perfect for people who are feeling stuck or on a plateau with their progression, even though they're stretching and they're strengthening and they think they're doing all the right things, but they're just not getting where they want to go. And to be fair, I'll be honest with you, there are some people who don't want to do the stretching and the strengthening and just want to take the fast path to getting rid of this chronic low back pain. Regenerative medicine will work for you too. The great thing about it is there's no downtime, there's no drugs, there's no surgery. It's holistic, it is all natural, it's non-invasive, and you can get back to doing all the things you love as soon as you leave the clinic. When do you need to seek help for your chronic low back pain? Well, if you have been suffering for more than 2 weeks and your pain is staying the same or it's getting worse, I'm going to highly recommend that you seek help from a professional to figure out what your next best steps are. Now, you may have already done that and you have already tried everything and you have already been everywhere. Then I'm going to recommend you call that phone number that's in the description box below and find a regenerative therapy specialist near you. And if you are someone who refuses to have surgery or injections, then you need to find someone who can help you through a natural, holistic healing program, because movement is life means that every tissue in your body is designed to heal itself as long as it's moving correctly. So you need to find someone who can help you move correctly to decrease your pain and get you back to doing all the things you love. So I'm going to tell you about one of our patients who came in to join us recently. Her name is Jane, and Jane is retired, and she is so excited because in her retirement, she finally gets to have the garden of her dreams. So she finally has time to spend all day out in her garden, and you can imagine all that entails, from pulling weeds to planting to raking to trimming and pruning and all the things that she does on a regular basis significantly increased her low back pain. Now, Jane's retired, right? She's suffered with low back pain on and off throughout her life, but she's always managed to just get over it. But this time it was way worse, and it was keeping her from getting out into her garden every day. Now, it was fantastic because Jane was actually moving pretty normally when we first saw her. She was just stiff. She just had that chronic stiffness from low back pain. So we did a 6-pack of Shockwave therapy with her, that regenerative medicine technology I was talking about earlier. And along the way, she saw herself being able to get back to more and more of her gardening tasks, which that was her big goal. Now, along the way, she also found out that there were other things that she was able to do that she hadn't been able to do in years, like bend over to put dog food in the dog bowl. And she was super excited to be able to do that and not to have to get down on her hands and knees every time she needed to feed the dog. Although I think the dog actually liked her getting down on her hands and knees because then she could give her kisses on her face. But anyway, Jane was super happy that she could just bend over to give the dog her dog food, but more happy that she could get back to the gardening that she loves doing and the whole thing she was looking forward to doing in her retirement. If you want to be like Jane and get back to doing all the things that you love doing and you're in the Maple Valley area, I'm going to encourage you to click the link below to discover a free discovery visit where we can talk more about regenerative therapy and how it can help you. If you don't live in the Maple Valley, Washington area, there is a number below for you to call in the description box where you can find a regenerative specialist near you. And if you're looking for more help with your low back pain, I'm going to have you check out this video right over here.